Hi, everybody. I am Dr. Joel Richneck and very excited to bring to you this webinar regarding a field that I'm very passionate about. And in it, I hope to impart upon you all just some more information about this world of regenerative medicine, and also demonstrate not only is it a very powerful alternative to surgery, but in many cases, an even stronger alternative to surgery, better alternative to surgery. So as Dana mentioned, we'll try and impart some of this information through the webinar first, and then certainly any questions that have not been addressed through the webinar, we'll have an extensive question and answering after the webinar, which hopefully we can address all your questions. So a little bit about myself. I've been a practicing physiatrist in Grass Valley for over 17 years. I co-manage the clinic here at Mountain View Rehabilitation with my partner, Dr. Mike Jensen. And I am double boarded in both physiatry as well as sports medicine. Now I've been practicing, I've been a Regenix affiliate rather for about 5 years now, probably getting closer to 6 years now at this point. But prior to that, I've been either practicing or studying regenerative medicine really since I was in residency. So it really has been a passion of mine for a long time, and it's evolved in my practice ever since I first started studying it in residency. And when I'm outside the clinic, something else about myself is I have a very active lifestyle, and I enjoy exploring and venturing in the mountains with both friends and family. And this active lifestyle, I think, has really shaped my treatment philosophy. I certainly understand what it's like to be injured through various activities, and equally as important, I understand how frustrating it can be when we have these orthopedic injuries that takes us away from these activities. And that process has really taught me a lot in terms of how to recover from these injuries and get back to these activities. So again, it really has shaped my treatment philosophy, which ultimately is we have a passion here in this clinic for getting people back to doing what they're passionate about, back to their activities. So why are you here? Well, I would say the common denominator has to be pain. Many of you are in some sort of pain due to an orthopedic injury. And as we all know, once we are injured, it takes us away from the activities that we enjoy. There's downtime. Each and every one of you has gone through, I'm sure, your own treatment adventure, treatment journey, if you will, and may have tried a variety of conservative treatment and has been told maybe by traditional medicine or even your physician that the last option is surgery, and you're here because you want to avoid surgery. Or you've been told that you're not a surgical candidate. You're here to learn options because you kind of gone down the cascade of treatment and are running out of options. Many of you may have been on medications for a long time to address pain related to injuries, and again, looking for alternatives. But ultimately, many are here because you want to get back to life, what you enjoy doing. So today's discussion will spend a brief amount of time just reviewing what are current treatment options in orthopedic care. Many of this will be review for you because you've probably gone through it yourselves already. And then we'll jump into this world of regenerative medicine, define what it means, as well as another branch of medicine called interventional orthopedics, which is, as I'll explain later, a very important part of making regenerative medicine successful. And then I'll explain what is Regenix, and in many ways, furthermore, I'll explain the many ways that it is far different than any other stem cell clinic out there. And we'll touch upon some of the misrepresentations of these other stem cell products. and then we'll wrap it up with an extensive question and answering session. So current options in orthopedic care basically fall into three different categories. One is medications, then there's conservative care, and then ultimately, again, what's left to be as last stage end option is surgical care. So again, as we go through our injury journeys, if you will, many of us start with just medications. We may first start with over-the-counter medications, Tylenol, ibuprofen, and if that's not quite adequate, many of us get prescriptions from our physicians for prescription strength medications. Many of us are learning, however, through this process that this is simply, it's a Band-Aid. It's not addressing the issue. And in many cases, many medications do have side effects, some of them serious. But again, ultimately, they just don't address the issue. The next phase is reviewing conservative treatment. And again, many of these treatments many of you have probably gone through already, consisting of physical therapy, chiropractic treatment, acupuncture, bracing. And at heart, I'm a rehab doctor, so I really do believe in the physical therapy model. And I always explain to my patients that there are two goals to treatment. First and foremost is to address the pain issue. And then once that's addressed, the next critical step is to try and address some of the mechanical deficits, if you will, that have either led to the injury or itself, or may have come about due to the injury, but are perpetuating the injury. And oftentimes, again, physical therapy, I like to call it the complete treatment because they can address both issues most of the time. If we're having challenges getting the pain issues addressed, then a lot of times we'll resort to injections. Most typical injection is steroid, but there's also hyaluronic acid, which is a specific lubrication injection specific for knee arthritis. But like medications, steroids, of course, have side effects. And again, sometimes it's unsuccessful at addressing that pain issue to allow the rehab process to get going. And then ultimately, again, particularly in regards to traditional medicine, the next step to consider if all else fails is visiting and receiving surgical consultation, who has the potential of providing surgery, which either is replacing a part, removing tissue, or in some cases, repairing tissue. And at one time, we all believed that surgery was the panacea. If all else fails, surgery can address it. But we're finding over time that surgery, this treatment option also has holes in it. First and foremost, it's not always effective. Secondly, there's obviously various risk factors to surgery. Doesn't always work, and ultimately, you can't undo it once it's done. Interesting thing about surgery, in the last 5 to 10 years, there's been far more research regarding surgical outcomes than there has been in the prior 50 to 60 years. And what the research is telling us is there is indeed holes in this surgical model. And research tells us that up to 53% of surgeries have been shown to be ineffective. So again, it's not the panacea that we once painted it to be. There are holes with this particular model. So the question begs, are there options? And so what I want to spend the rest of the time talking about tonight is explaining this world of regenerative medicine. And again, trying to press upon you, this is not only a very powerful alternative to surgery, but in many cases, a better alternative. What is regenerative medicine? Well, in a nutshell, what it is placing your own cells in injured tissue, namely platelets and stem cells, to either repair injured tissue, whether it be a tendon tear, a ligament tear, meniscal or labral tears, nerve injuries or disc injuries, or in other cases, addressing the symptoms that stem about from degenerative conditions such as arthritis and getting people back to their activities once done. What can be treated? Well, we're an orthopedic clinic, and so we treat all joints. And virtually the vast majority of orthopedic issues can be addressed using regenerative medicine, ranging from, again, ligament and tendon tears, arthritis, meniscal tears, and again, addressing knee joints, shoulder joints, hip joints, the spine, elbows, and hands, as well as feet and ankles. The next field I want to introduce to you is this world of interventional orthopedics. And this is truly the critical division of medicine that makes regenerative medicine successful. Without interventional orthopedics, regenerative medicine really isn't a great option, but with it, makes it a very powerful tool. And ultimately what it is being able to place, again, the cells very specifically in the area of injury by using imaging technology, namely fluoroscopy and ultrasound imaging, which allows us to guide, again, these cells very specifically to the injury itself or to the arthritic region of the joint. The correlate to interventional orthopedics is interventional cardiology. Now, many of you may remember that at one time, any type of cardiac procedure was done by a cardiothoracic surgeon who would have to open up the chest in order to access the heart to perform treatment. So very bright cardiologists discovered that using, with the help of technology, namely fluoroscopic imaging, they could pass a catheter from an individual's leg vessel and guide that all the way up to the heart to perform treatment, whether it be placing a stent or removing tissue. So a minimally invasive procedure, and this proved to be such a powerful modality, or treatment option rather, that it ultimately took over 80 to 90% of what cardiothoracic surgeon would do. So again, the correlate is interventional cardiology. The leading minds in interventional orthopedics as well as regenerative medicine feels that the combination of these technologies will, over the next 10 years or so, replace up to 70 to 80% of what currently is being done by orthopedic surgery. Again, it's minimally invasive, needle-based, image-guided injecting of cells, specifically in the injured tissue. Now, diving into this a little bit deeper, the tools that orthopedics have in terms of procedures range from simple injections all the way out to surgery. And so the vast majority of physicians who practice this field are able to do simple injections. And what that means is they're placing a medication like steroid into the general region of the joint. They're not necessarily trying to address a specific injury. There's not necessarily a specific diagnosis, and they're not trying to target a specific tissue. It's really ultimately a shotgun approach, hoping that the medication gets to the site of injury. In the advent of technology, there's many of physicians today that have incorporated ultrasound imaging into their practice. And this allows them to get a little closer to the target, but again, they're not necessarily addressing a specific tissue and not trying to get the medicine to the specific tissue. This is in contrast to interventional orthopedics, who first and foremost is going to try and make a diagnosis. And to do that, recognize that within a joint, say in this case, the hip joint, there are a variety of tissues that can be injured and could be contributing to the primary pain generator. Or it could be a combination of these tissues. So first and foremost, a diagnosis is made. And then again, using ultrasound imaging or X-ray guidance, we're able to place the medicine very specifically to the injured tissue or tissues as it may be. Likewise, in the case of a knee joint, there's a variety of tissues, again, namely tendons, the joint itself, the bone, ligaments, even muscle that could be contributing to the pain issue that could be the true injury. So, again, a joint isn't just a simple structure. It's a very complex structure. And there's multiple tissues that can be contributing to the injury or the pain itself. And then finally, the shoulder, very much the same situation. So what do we inject? Another umbrella word for these cells is orthobiologics. And under the orthobiologics category falls concentrated platelets, platelet lysate, as well as stem cells. Platelet-rich plasma is basically cells that we get from a blood draw. So the blood's drawn. Once drawn, it goes to our lab where it's processed into a very concentrated platelet solution. And platelets themselves are a very powerful healing tool. In the platelet contains various proteins, namely cytokines and growth factors. And cytokines are a protein that essentially it's a very powerful anti-inflammatory. And what its objective is it mops up chemical messengers or bad chemicals, bad toxins, namely things like chronic inflammation. And once that's mopped up, oftentimes the pain issue is addressed. But equally as important, once that's mopped up, now the joints or the tissue's ability to repair itself is re-implemented, it's rebooted. If chronic inflammation exists, that natural repair mechanism is basically forestalled. So once that repair process is rebooted, now the growth factors, which are really the espresso shots for the repair mechanisms to start kicking in, takes over. And the combination of the two really produces a very powerful healing response, again, once that foundation of healing has been rebooted. So we use platelets mainly to address tissue tears, such as ligaments and tendons, as well as mild to moderate arthritis. The next tool we have is platelet lysate, and that's simply a platelet procedure. Again, it's a blood draw that allows us to get the platelets. Once it's processed, it goes through an additional step where the membrane of the platelet is lysed or disrupted. And what that does is allow for immediate release of these cytokines and growth factors. And we're finding this a very useful tool to use around nerves because it really is a very powerful anti-inflammatory, whereas pure platelets can actually cause more inflammation sometimes. So we have to be careful around nerves. So we're using this primarily to address compressed nerves, such as the case with a radiculopathy or, say, a carpal tunnel syndrome. And then finally, there's the stem cells, which is our most powerful tool. And the best way to describe a stem cell is it's basically like a general contactor, or if you will, a conductor of an orchestra. And what it does is it coordinates all the players of the healing process, gets them to the area of injury, and coordinates that healing response in a very synergetic manner to get the healing process up and going. We isolate stem cells from the bone marrow concentrate. And again, stem cells are very powerful healers. They repair tissue. And we use stem cells primarily for more advanced arthritis or for more severe tendon and ligament tears. Now, our procedure breakdown, 80% of what we do is platelet-rich plasma injections, which means only 20% of what we do is stem cell. And what that tells us is that, again, platelets are very powerful. The other nice thing about platelets is they're less involved. It's just simply a blood draw followed by the processing, followed by the re-injection. And that's usually done within a 2 or 3 hour period. Whereas a stem cell procedure is much more involved, and I'll explain that procedure a little bit later. And of course, it starts with an aspiration procedure. So it's a little more involved. And ultimately, that leads to a significant cost difference. Not everybody needs stem cells. Now, what is Regenexx? Regenexx truly is one of the pioneers in not only regenerative medicine, but interventional orthopedics. Not only have they developed and recognized these various procedures, but they've also progressed and evolved these technologies such that they've co-evolved these two interventional orthopedics and orthobiologic technologies to create a very powerful and advanced regenerative medicine treatment, which again ultimately has been proven to be a very effective alternative to surgery. Now, many of you, I'm sure, have done your research regarding stem cell clinics. And as you've all discovered, there's a lot of options out there. But what I want to go over next is really to explain how Regenexx is a far different process than anything else out there. And through many modes. So I'll touch upon each one of these more specifically, but experience, their devotion to research, both clinic and lab, as well as evolving their lab platform, evolving image guidance. Another aspect of research is their data registry. And again, I'll talk about these more specifically as we go on. Furthermore, only specialists do Regenexx procedures. Many other clinics out there are using very much generalists, may not even have a correct diagnosis. We have different cell sourcing, different harvesting techniques, as well as different dosing than anybody else out there. And ultimately, what I'll try and point out to you all is that all this matters. All this matters from the standpoint that by implementing all of these various differences, our outcomes are significantly better and different than it would be otherwise. So, as I mentioned earlier, Regenexx has pioneered many of these procedures. They've been doing this longer than just about anybody on the planet in regards to humans. There's one other physician in France who may have been doing it for a little bit longer. To be fair, we really have our equine colleagues who have been doing this technology on horses for probably close to 30 plus years now. So experience matters. Again, experience does result ultimately into better outcomes. Our lab platform is significantly different. The vast majority of clinics out there have a basic centrifuge platform, bedside centrifuge. And what that means is once the cells are collected, whether it be bone marrow collection or a blood draw, it's put into the centrifuge machine, a button's pressed, and out comes the same product for everybody. They have no ability to concentrate or create different dosages, what have you. And so everybody is treated very generically. What our platform does is, yes, we use centrifuge technology, but we also have a very sophisticated hood and appropriate tools that allows us to process the material quite a bit more. And ultimately that leads to more customization, more concentration. And again, ultimately that leads to much more significant and better outcomes. Regenexx cell source strictly is, for stem cells specifically, is bone marrow concentrate. Reason being is that it's been found to be the most powerful source of stem cells. Plus, it's the only legal source of stem cells. Adipose tissue is also another option to get stem cells, but currently that is illegal to do here in this country. And I'll touch upon this a little bit more later in the webinar, but another source of quote unquote stem cells is the amniotic product. But I'll show you a little bit later that there's no live stem cell in that product. So again, we use the most powerful source, which is bone marrow concentrate. We have different harvesting techniques. We have developed techniques that really helps us optimize the number of stem cells that we can get from the aspiration process. And really this technique has allowed us to increase the stem cell yield by 10 to 15 fold. And what we've discovered is numbers matter. The more stem cells we can get, once again, the better outcome we're going to have. And I touched upon this earlier, but dosing is important. Through our platform, again, we can get a much more higher concentration of platelets, a much more higher concentration of stem cells. And again, not everybody needs the same dosing. I mean, just like medications, everybody responds differently to different dosing. There is a customization process to which can, again, foster better outcomes. And then I've touched upon this quite a bit already. Image guidance really is the key to making this work. There are many clinics out there who will do these injections, these procedures, without guidance. And again, it's a crapshoot. You have no idea what you're injecting into. Guidance is important. Now I'll touch upon the next phase here, which is really Regenx's devotion to the research. And if there's one thing that really kind of made the difference for me in terms of making my decision as to becoming an affiliate of Regenx, was their devotion to research. Because I've learned over the years that if we don't have the proper research, it doesn't matter how exciting the technology is, it's not going to be around long term. The research has to be put forth. So anybody who's going through one of our procedures, we invite them to enroll in the data registry. And what that means is that we'll follow you through the course of questionnaires and what have you over the course of several years to measure outcome. And so this has given us one of the biggest data banks on the planet in terms of regenerative medicine and research. And we've been able to implement much of this information, data, into our research, such that Regenx has published 44% of the world's literature on this topic. And again, information is powerful. And the better information we can get, the more we're going to be able to evolve this process. And once again, ultimately that leads to much more better and significant outcomes. So the data registry, but clinical research too, constantly trying to tweak the process to make, to be able to apply this to more and more injuries and to optimize the treatment once it's done. So again, Regenx research, it contributes 40% of the entire world's literature on regenerative medicine. The devotion to research is really critical to evolve this field over the course of time. And again, to make it sustainable. Likewise, there's lab research as well. We're constantly trying to tweak the system to make it better, to make it more effective, and again, ultimately to improve outcome. Now, as I mentioned a moment ago, many clinics out there, many of these procedures that are done in other clinics are done by generalists. It may be a nurse practitioner, it may be a physician's assistant, it may be a family medical practitioner. All Regenx affiliates are specialists. We have a passion for musculoskeletal medicine. This is what we do. It's all we do. So this type of background, this type of skill, this type of knowledge, again, ultimately allows us to make more specific and accurate diagnosis. And once again, I mean, that really is a critical component to making any type of treatment successful. A typical procedure visit flow, as I mentioned, with the platelet-rich plasma, it's a simple blood draw followed by the processing, and then a re-injection within a few hours, couple hours after the blood draw. Prior to this, though, we always evaluate the patient, spend an hour with the individual, and ultimately from that process, we were able to, again, come up with a very specific diagnosis, outline treatment options for you, and essentially give you a prognosis, let you know if you're going to be a good candidate for this procedure, a fair candidate, or a poor candidate. And then after the procedure is done, typically rehab is necessary for most folks, again, really to address those mechanical deficits that I was alluding to earlier. And then typically we see folks a couple months after the procedure. The stem cell, as I alluded to earlier, much more involved. It starts with initial evaluation again, but then the procedure itself is comprised of 3 different procedures over the course of 3 different days. And usually it's a Monday, Wednesday, Friday. The first procedure is a prolotherapy injection. And essentially what that does is prepares the tissue for the stem cell that we do 2 days later, tills the soil, so to speak. On day 2, this is the stem cell day, and that starts with the bone marrow aspiration. We aspirate the bone marrow from the pelvis to access stem cells. We numb people up like crazy, and consequently, that procedure is pretty benign. But I will share that once we start pulling the marrow out, that negative pressure does get to be a little sensitive, but it's a quick process. The processing for the stem cell, the bone marrow, takes a bit longer. That can take up to 2 to 3 hours. And then we bring the individual back in after the completion of processing, where we re-inject. And then day 3 involves, and I should say on day 2, going back to day 2, in addition to stem cell, we're also able to access, to obtain platelets from the bone marrow. And so we inject both stem cell and platelets at that time. Then on day 3, we inject more platelets because the growth factors that are contained in platelets are very important in terms of, again, helping that stem cell get as much of a powerful healing response as possible. And once again, that's followed by rehab, as well as follow-up visits, usually a couple months after the procedure. So that's the world of regenerative medicine in a nutshell. What I wanted to go over next is some of the hype regarding some of these products, if you will. And the biggest offender by far is this world of amniotic, quote unquote, stem cell injections. And I'm sure many of you have come across many clinics trying to promote this tissue as a stem cell tissue. The problem with it, and I will, the amniotic product does have growth factors that can help implement the healing process, but it is fraud to call it a stem cell. And the reason I say that is that we have done extensive research, as has at least a dozen very reputable universities on this product. And all of the research shows us that it's dead tissue. There are no live stem cells. So to call it a stem cell product is fraud. Furthermore, the FDA has categorized this tissue as a dead tissue product. They recognize that there's no live stem cells. And they have made it illegal for any clinic to call it a stem cell procedure because of that. Problem, however, is that they've not been able to enforce or regulate that until the last couple of years. And in fact, in the last 12 months or so, they have shut down several clinics and even jailed a few of these clinics for not following the regulations. So as I mentioned, there are growth factors in the amniotic product that are helpful in getting the healing process up and going. But their potential or concentration is far less than even just a regular platelet procedure. But oddly enough, they're highly more expensive than a platelet procedure. Many of these procedures are done in chiropractic offices. Again, as I alluded earlier, typically without guidance, oftentimes by a PA or a nurse practitioner. Again, want to emphasize these are dead cell products, much more expensive than even platelet injections. One of their marketing schemes is that they'll tell you that your stem cells are just too old to be effective. Fact of the matter is, no, they're not. I mean, if you're living, your stem cells are still powerful. We've done a lot of research, and we have found that the age really does not determine how well one does with stem cell procedures if it's if it's taken from the bone marrow. Older patients do equally as well as younger patients in terms of responding to stem cell procedures and platelets procedures. So again, very important to understand that there is no live stem cells in this amniotic product. So touching further upon, again, many of you are doing your own research. What I want to share with you is just some red flags to, watch out for as you're doing your research. Many clinics will try and, tell you they're giving, a once in a lifetime discounting or offer you financing. If they have to do that, then, that's probably going to be a red flag. Furthermore, many of these clinics are telling folks that, this is the magic cure-all. It's going to cure everything from neurological deficits to nerve issues to what have you. That's a huge red flag. We have plenty of research in how it is very effective at orthopedic issues, but the research regarding many of these other areas of medicine are still young and still ongoing. They'll also tell you everybody's a candidate. They're not, they don't discriminate between anybody. They'll tell you your prognosis is great. That's a big red flag. And once again, any amniotic product, any cord blood product, calling it a stem cell is essentially fraud and illegal. And in addition, I touched upon this earlier, fat is also a source of stem cells, adipose tissue. But currently it's illegal to have this procedure done in the States. So who can you trust? Again, as you do your research, I invite you to write this down. This is a neutral webpage, stemcellreview.com. And they do a very admirable job of vetting all clinics that offer this procedure. And they go through various categories as to whether or not they're doing research, whether or not they do image guidance, what their training has been, that type of thing. So I found it a very nice tool to, again, just give you a little more neutral information, if you will. So in summary, we have really evolved this field of regenerative medicine and interventional orthopedics, and have really found this to be a very powerful alternative to surgery. And once again, in many cases, a much better alternative to surgery. The combining of these two fields, again, regenerative medicine with interventional orthopedics, makes this a very powerful alternative. Regenix is the leading provider and researcher in this field. And again, research probably is the most critical aspect in terms of evolving and advancing this field. Regenix is the leader of research. And again, that's truly why I became an affiliate. And then, of course, be cautious of the magic stem cell approach. So that's the gist of the webinar. Again, first and foremost, I want to thank everybody for coming on out here. We'll jump into a question and answering session next, but I invite you, if you feel like you want to look into this further and see if you might be a candidate, give us a call. We'd be happy to set you up for an initial evaluation. We take most insurances, so I mean that part is covered by insurance. So with no further ado, we'll open the field for questioning. Is there anything else you wanted to implement or bring up, Dana, before we jump into questioning?
Nope, I think you've covered it all, and it looks like we've got a few questions already, so why don't you get going with that?
Okay. All right, so looks like Lori is first. Hi, Lori, how are you? Can you hear me?
There we go. Hi.
Hi.
I was wondering how long the regenerative is supposed to last, because I've actually had some injections, and most people that I know that have had them have had to go back after a couple years and get another shot. What's your experience with having to get additional shots of regenerative?
Yeah, well, so it depends on the issue. For example, if it's a rotator cuff tear or a meniscus tear.
A knee.
Sorry?
And it's a knee.
Oh, okay. So maybe a meniscus tear or ligament tear, or was it for arthritis?
I think arthritis. Yeah.
Okay. Well, I mean, it really depends on the severity. So if it's, mild to moderate, oftentimes we'll treat that with a platelet. And yeah, I mean, for the most part, we're getting at least 6 or 7 years of response to that. So for arthritis, it may not last indefinitely. And I would say the same case for if it's more severe arthritis and we're using stem cells, on average, we're probably getting 7 years. Whereas other tissues, again, like tendon tears or ligament tears, really can, or even meniscus tears, it really can cure that issue as long as the person afterwards has gone through the appropriate rehab to correct the mechanical deficits.
Okay. Okay, thank you.
You're welcome. Let's see here. So let's see. Tricia, can you hear me? Let's see here. I think I lost you. Tricia.
Here we go. Start video.
Can you hear me?
I think there's more audio than anything.
Tisha?
I can hear.
I'm sorry, is it Tisha? I said Tricia. I'm sorry.
Yeah, Tish. Yes, I can hear you. Can you hear me?
I can hear you, yes.
Oh, good. Okay. We did have a consultation on the phone about a month ago, I think. And I have I have the osteoarthritis in my hips, the right one. My MRI report says that it's advanced. The left one is moderate. The right one is advanced. That's where I'm having all the pain. I've been watching some of the procedures when certain doctors are doing it online. I think the people from Colorado, I think I watched Schultz, I think it was, doing a procedure, and I noticed that they're very, very specific about where the needle goes. Say a labrum tear would go right on that spot. But if my hip has osteoarthritis and it's a large area, how do you get specific with that? How does that work?
Well, and that's, I mean, you bring up a good point. Hip isn't necessarily one of our better responders. And in large part because of that issue. I mean, we're able to place it right at that interval where the femoral head joins into the pelvis. And we can slide it in the joint, but unlike joints like the knee or even the shoulder to some degree, we can't actually layer it on top of the surface of where the arthritis is. So that is actually one of the reasons why the hips isn't always the best responder. But I mean, given that, we still have many people who do very well with hips. The vast majority I find typically do quite well. Now I'm just looking at your MRI report real quick.
Okay.
And so yeah, advanced on the right, mild to moderate on the left. Now, one thing that's very important to appreciate regarding hips is, if there's any evidence of like bone marrow edema or cyst formations on the bone, then that can even put, the prognosis even further down the list. And so let's see. So let's, I'm not seeing that they're reporting. I don't actually have the image up at the moment, but reading the report, they're not reporting that. So that's a good sign in their case.
Mm-hmm. Right. Okay. So I know that I know you've seen a lot of people, and probably don't recall the MRI. When we talked, you said it had not gone into the bone. Anyway, what level of candidate do you think I am for doing it?
Well, so Whenever it comes to hips, we we always like to point out that we may get we I would say 40 to 50% of people respond to hips. I mean, that you typically give them a low prognosis, and with the hopes of over delivering on the flip side of that. So just as a general rule, if there isn't the cyst formations on the bone that I had mentioned, we usually give that figure of 40 to 50% prognosis.
Okay. Okay.
Is it helpful to have the left side done as a preventive?
Well, they
like
do.
a early
I think that
intervention?
when I spoke with Dee Marie, she said that probably if I go through with a procedure, that you would also inject some of the, was it stem cell or platelets, or both, according to how much I produce in that left hip as well, because it's got very little cartilage as well. It doesn't hurt, but.
Gotcha. Yeah. So we try and get enough stem cells for both, and in most cases we're successful at getting enough stem cells to do 2 joints. It's a little more challenging to do more than 2 joints, just because of numbers. I mean, we try and shoot for about 400 million cells per joint, and so with that type of guideline, typically more times than not we have enough for 2 different joints.
I see. Okay. All right. Thank you.
Okay. Well, thanks for your questions. Okay, moving right along. Robert, can you hear me?
Unmute myself. Can you hear me?
Yes, I can hear you.
Okay. I saw you about 1.5 years ago. I have a rotator cuff issue with my right shoulder. And you said at that point in time that the tear was separated 3 centimeters, 3 something, and that it was too great for the procedure. Has anything changed in the last 1.5 years that would make me a candidate for the procedure?
Let's see. Let me pull up your film here. Yeah. So the problem was the tendon itself is retracted, and so if the retraction is less than 1 centimeter, typically we can treat that. It says that yours is retracted by 3.5 centimeters. So unfortunately, nothing's really changed since that time to improve those prognosis.
Okay. I've been using your exercises and managing, and then I've just gone through a hard period, and I'm about to schedule surgery, which I hate, but it seems to be the one alternative to deal with this at this point. Okay, that was my question.
Okay, well, sorry I couldn't give you all right, well, good luck with the surgery. All right, thanks for the call. All right, any other questions out there? Okay. Victoria, can you hear me?
Yes, I can. Can you hear me?
I can.
Okay, great. Hi, I have a right knee arthritis. I've had a couple cortisone shots, and the doc says that he won't even do any individual repairs. He wants to do a total knee, and I really don't want that. So my question is, I had a trauma and a meniscus tear on the medial side. And he said he removed, years ago, the doc removed about 70% of the meniscus. And then, because of the angles, because the meniscus isn't there anymore, the knee starts to kind of cave in when you walk. And so that's made various other things hurt in my knee. So it seems like there's probably 3 different areas in my knee that hurt. Does that mean that I would need more than 1 injection, or that would I just have to be evaluated?
Well, so getting evaluated certainly is the best way to give you specific information. But just to let you know, I mean, most of the time when we're doing these procedures, we're addressing multiple issues. We'll address the arthritis. Oftentimes there's ligaments on the inside of the knee that are loose, they're lax. And so
Yes.
we inject that to tighten up. Or in other cases, the ACL may be disrupted to some degree too. So we also try and treat that. So more times than not, we're treating multiple structures during the course of the procedure.
And so you would have enough of that plate PRP to treat those various areas when you're in one session?
Yeah, so if it's amenable to platelet treatment, we don't typically have a problem getting enough platelets. Platelets are pretty plentiful. It just means that we got to draw a little more blood. The stem cell is a little more limited. So, but if you're at a level where your surgeon's telling you need a knee replacement, that may be at such a level that stem cell might be a better option for you anyways. It's a little more powerful in that sense.
Okay, yeah, it's really hard to tell with him because he won't let me get an MRI. He says it's either the cortisone shot or the MRI and surgery. And it's like, I'd kind of like to, that's not quite good enough for me. I need a little bit more information so that I can choose the way that I want to go. But okay, so he says that I have moderate arthritis, but that because of my pain issues, that's why he would do the knee.
I see. Well, typically before doing these types of treatments, I order an MRI if it's not been done beforehand.
Okay.
So if we needed more information, we have ultrasound imaging here in the clinic, so we can, not only examine you, but check it out with the ultrasound and see if that gives us any more information. But oftentimes X-rays won't give us the full picture in terms of, being able to assess the degree of arthritis. So,
I see.
Yeah.
Can a person drive home from one of these themselves? Like if I got a stem cell injection, can you drive home, or do you need a driver?
Typically, we recommend a driver simply because,
okay.
A lot of times, we oftentimes give folks like a Valium before the aspiration procedure, and then after the injection, they're pretty sore. So it's best to have a driver.
Great.
I had some folks who didn't, but I'm always more comfortable telling people it's probably best to have a driver.
Okay. Thank you very much.
You're so welcome. Thanks for the questions.
Mm-hmm.
Okay. Leslie, can you hear me?
Yes, I can hear you.
Okay. Hi there. How are you?
I'm doing fine. I'm really looking forward to my procedure next week.
Aha. Okay.
Finally got all my doggone vaccination over.
Oh, for crying out loud. Well, good for you. That's fantastic. Well, we're going to be excited to see you. You say next week?
Yeah, I come in on Monday, and I guess the stem cell's done on Friday.
Beautiful. Yes. Well, no, we got you Monday, stem cell on Wednesday, and then the final platelet we'll do on Friday.
Uh-huh.
Yeah.
Hey, by the way, the day that the stem cell's done, should I plan, I will have a driver with me. Should we plan on spending the night there on Wednesday night also? Or will I be can I be driven home, which is 2 hours from there?
2 hours. That's not too far. You're going to feel more comfortable doing that. As long as you have a driver, that shouldn't be an issue. We've certainly had people drive home from more than 2 hours.
Okay.
Yeah. How are things? Any changes since we saw you last?
Actually, I think my muscles and legs my right leg is getting stronger because after talking to you, I've started riding a stationary bike,
Good for you.
and that's helped quite a bit with because the fire. I'm a swimmer, and that's how I've kept my strength up. And the fire in September, along with COVID, I haven't been able to get into a pool and swim because I swam in Oroville at the hospital's gym, which is
Oh,
still.
goodness.
So the bicycle has been good. I wear the knee brace with it, and it's helped my muscles get stronger in my right.
Fantastic. That's
And
fantastic.
in fact, what I've just learned is it's really good if I start the day off riding the bicycle because it seems to make my my knee less painful.
Uh-huh. Yeah, no, it's a good way to just kind of warm up the tissue, warm up the joint. And, I always like to describe motion as lotion. It loosens things up and makes you feel better.
Right,
Yeah.
right.
Well,
So,
I'm glad you're working on the strengthening. That's wonderful.
right. Well, yeah, it's wonderful for me too to not be in so much pain and be walking better on this uneven ground that I live on.
Yeah.
And
Yeah.
and it's we're really busy because we went through another fire this year. So yeah.
Goodness. Okay.
So,
Okay.
I was kind of wondering how long will the rehab last? I'll be going to, I guess, physical therapist in Oroville is what Dee Marie has me set up for.
Yeah. So, it's variable. Some folks go for maybe 6 to 8 sessions. Some people like to spread it out a little bit longer. Whatever it takes. And, part of it just depends on how you respond, how quickly you respond, and how quickly you're progressing with the exercises. But, I always like to describe, once you reach that point where you got a pretty good understanding of all the exercises that you need to be doing and you can do them on your own, then that's probably a good time to, go into
Right.
So.
And once, am I going to be at a point where I won't need to wear the OA knee brace?
Absolutely. So we recommend
wonderful.
wearing the unloader knee brace just for the first 6 weeks.
And I hate the knee brace, but I do realize it makes my knee a lot more stable on the uneven ground.
Yeah. And plus what it's going to do is it's going to protect that area of your knee where we place the stem cells.
Right.
Or the more we can protect that, the more established that's going to get, the better outcome we're going to have.
Got it.
Yeah.
So really, I'm not as good as I might be about having that brace on all day. But once the procedure happens, I will want to have the brace on all day.
That's it. Anytime you're weight bearing,
okay,
and potentially putting stress over that area of your knee, you want to be wearing the unloading knee brace.
And after the procedure, when can I get back in the hot tub? Well, it warms that joint up, man.
Sure, I get it. I get it.
Although I bought one of those infrared things and I haven't really tried it. My husband's been using it though.
Okay. So usually wait till Saturday, just because we want.
Oh, that's not bad.
Yeah, we want all the areas healed before jumping into warm water like that.
Okay. And one last question, which I could have asked, I would ask Dee Marie tomorrow, but I'm going to ask you since you're there.
Yeah.
So I take Xarelto, and that's a blood thinner or what? I know they don't call it blood thinner, but when do I stop taking it? It's on Saturday if I go in on Monday.
Well, no, it's okay for that Monday procedure, but stop it on Monday because you want to stop it 48 hours before we do the aspiration.
Oh, before the aspiration. That's what I was, after watching your presentation here, that's what I was wondering.
Yeah.
Okay, so the aspiration's on Wednesday, so I'll stop it on Monday then.
Exactly. Yes.
Okay. And not that you necessarily need to know about, well, maybe you do. I changed my my blood pressure medication, and my blood pressure, to me, it seems kind of low, but maybe I have a consult with my doctor because he wanted me to do that. But I don't know which one is the dystolic and the systolic, but my low blood pressure is in the high 60s now.
Oh, wow. Okay. Well, what's the range? What's the higher number?
Well, this morning it was 95, but it's usually just like 110
I mean,
over 68.
as long as it's mostly around 110, I think that's fine.
Okay.
Fine. But
Yeah.
I mean, certainly follow up with your primary care physician.
Yeah.
He'll give you a better idea, he or she.
It's kind of amazing, this new world of Zoom medical things, because I have a Zoom meeting with him tomorrow.
Oh, perfect.
And here I am talking to you.
It's a brand new world, no question about it.
It is, but I like not having to drive 45 minutes to go see the doctor. So that's great.
Absolutely. Well, good, Leslie. I look forward to seeing you on Monday and getting the process going.
Yeah, I'm excited about it. It just having ridden my bike, this stationary bike, which I've never had in my life, it's just improved things so much that I'm very optimistic about this occurring.
Fantastic. And that will serve you well. That will really help you optimize response, no question.
Thank you.
All right. Well, take care. We'll see you soon.
Uh-huh.
Okay. Karen, can you hear me?
Can you hear me?
Yes. Hi.
Yeah.
How are you?
Good. I had my platelet treatment 4 weeks ago on my shoulder from you.
Uh-huh.
And I have other issues, doctor, and I was just wondering how to proceed. I have 2 knees that are arthritic, and one of them had a meniscal tear. And then I have like really gross, horrible arthritis in both my feet. So I just wonder how to proceed next with you. Do we do one joint at a time? Do I need to have imaging before I see you again? I just wondered how to proceed.
Right. Well, I mean, imaging, oftentimes we can do more than one joint, by the way.
Okay.
Imaging is always helpful, but depending on the issues, sometimes we can get by with just like an X-ray and ultrasound.
Okay.
But, typically what we do is just, assess you first and just try and figure it out from there.
Okay. Because I had imaging on X-rays on both my feet with a podiatrist. And when she saw my feet, she immediately sent me to a surgeon.
Oh, no.
I would love to avoid surgery on my feet. It would cost me almost a year of my life. And then in 2019, I tore my knee, left knee, and I have arthritis in both knees, but I think it's more moderate.
Okay.
So,
okay.
Once I get over this shoulder and get on our way, I'd like to consult with you on those areas too.
Absolutely. No, fantastic. How's the shoulder doing, by the way?
It's doing good. Actually, I have an appointment with you tomorrow for a trigger point injection in my your physical therapists, by the way, doctor, are amazing. And they have helped me so much. And I've seen all 3 of them, and they are all amazing.
Fantastic.
And they've helped me a lot, but they recommended this injection tomorrow. And then I see them right after, so they can massage that in. But the shoulder where you did the injection is doing well, and I think it's still doing its thing.
Absolutely.
So I'm doing my exercises, I'm walking, I'm really serious about this. So
Good.
I would
No,
like, I'd like to avoid knee surgery down the road. I'd like to avoid foot surgery down the road. So
right.
I'd like to
Well,
see what you can do in those areas too.
Absolutely. I mean, you're still early, obviously, in the platelet process with the shoulder.
Yes.
Certainly
Yes.
look at these other issues and come up with some solutions. Absolutely.
Absolutely. Okay, great. All right. Well,
Okay. I'll see
thank
you tomorrow.
Doctor. Okay.
All right.
Thank you.
Bye-bye. Okay. All right. Jean, can you hear me?
Yes, I can.
How are you?
I'm doing fine. I'd like you to thank you for giving me the use of my hands back 4 years ago when I had a PRP injection for each of my thumbs. It's been a wonderful experience.
Oh,
And,
fantastic.
yeah, it is. I'm telling all of my friends about it who have similar problems. And I think even some of them have sought out this kind of solution to their problems. However, with advancing age, my some other fingers are developing problems, trigger finger, stiffness in the joint, pain, numbness. And I've called in to see if I can get an appointment for late April, early May, when I'll be down in that area. And I'm wondering if I need to get an MRI of my hands before I go, and will I need to have injections in each of the fingers, or is there kind of a general place you can put an injection that'll help the other 4 fingers?
Well, so, I mean, often with times with the hand, if we can just, I mean, oftentimes just an x-ray is more than adequate enough.
Okay.
At these other joints. So I'm looking, let's see, we have, I would imagine we probably have your x-ray from 4 years ago. Just trying to see if that shows any other findings on there. I know we primarily treated your thumb before. Glad you're still doing well, by the way.
Oh, yes, it's marvelous.
That's great. Yeah, and just to let everybody know, I mean, the thumb joint is one of those interesting joints that even with severe arthritis, oftentimes just the platelet is needed. Even though, you know, I advise stem cell for more severe arthritis, but the platelet is more than adequate for the thumb joint and some other joints, in large part because we treat very much the surrounding ligament tissue, and that process of restabilizing the joint is really a powerful component to that particular procedure. So again, glad you're still doing well.
Oh, yes. And I was surprised how relatively easy it was. I think I had the injection on a Thursday or Friday, and I was skiing the next Monday. So
I was going to say, it seems to me you were skiing very shortly thereafter.
That's right. And just gradually, and within 6 months, I would say the things had gotten so much better. It was quite noticeable. I was just amazed.
Fantastic. Well, good. Well, I'm glad you're doing well. So yeah, I mean, oftentimes if you can get an updated x-ray, that's probably all we need. And then the rest we could probably do with just the ultrasound.
Okay. And then am I looking at injections in each finger? So more blood is needed for all those injections, or is one draw, do you think, going to do it for maybe three or four more fingers?
Yeah, I mean, we can get plenty with one draw from multiple joints in the fingers.
Okay. All right. Thank you. I'll get that appointment made as soon as I can. Thanks.
That sounds good. We'll look forward to seeing you soon.
Okay.
All right. Take care. Okay. Let's see here. Any questions?
Dr. Ichak?
Yeah.
Belton does have a question. His hand is not raised. I'm not sure if you can unmute him.
Yeah.
There.
Can you hear me? Hello? Try that again.
Can you hear me?
Oh, there you are. Perfect. Hi, how are you?
Sorry, I had to press the button there. Dr. Ishnek, how are you?
I'm good, thanks. How are you doing?
Doing really good. I you did the PRP on my knee for meniscus tear. It's almost 2 years ago, and it's doing great.
Fantastic.
Yep. And
actually, almost 3 years ago, July of 2018.
Oh my, okay, good. And it did take a while, and I was losing faith a little bit. The 7 or 8 months came, but I started my PT after about the 6 weeks, and sure enough, 8 or 9 months, wow, I was just able to actually start running again. So,
Fantastic.
and my question is, Bob, our joint friend, had moved from the PRP to the stem cell. He had degradation of his knee, level 4, which is what I have. So the meniscus tear is much better. But my main question is time frame for. I'm pretty active now. I'm swimming, a little bit of light running, but I can't do too much yet. And I think I might be a really good candidate for the stem cell. So. Because for the degradation, and am I on the right track here for that?
Well, yeah, I mean, if it's as extensive as Bob's, then yeah, I mean, that would probably be a job more for the stem cell.
Okay. Should I'm thinking I should get a new MRI, and then would it be okay, MRI, and then come in and do another consult with you, and then go ahead and get everything scheduled?
That'd be perfect. Yeah, no, we'd take a look at the MRI. I'd go over that with you and just kind of give you an idea of just, what we're dealing with and the appropriate treatment and prognosis and all that.
Mm-hmm. Okay, great. I've talked with Bob, and he's just doing great wonders. He's going on, I think he's a year now, but he's actually, I mean, we know he's quite an amazing another level of ultra marathon guy, but
and the last I heard was when I saw him, I think it's been 2 or 3 years since I've seen him, but when I saw him, he said he wasn't going to do any more than like 15-mile runs, and I hear he's getting back to ultra distances.
That's what he told me too. But it's about that. It does seem like it's for both of us. It was in that 7, 8, 9 months where it really the healing and maybe it just takes that long to really. And I'm glad I was patient, because it did suddenly just at the 9 month to 1 year mark, it was remarkable that what started happening. So
okay.
Anyway.
Well, and that raises a good point. I mean, it is a process, no question about it. Healing is a process. It doesn't happen overnight. And so, with stem cells, I mean, that healing process goes all the way down to 12 to 18 months. And with platelets, yeah, I mean, up to 9 months is not unusual.
Mm-hmm. Mm-hmm. Okay, well, that's great. It's been a great seminar. I'm sure glad you did this. It kind of helped refresh me and get me back in the mode here to next steps, and being able to talk to you for a minute like this has been great. So,
well, I appreciate you attending and the call, and look forward to seeing you.
Yeah, thanks, doctor. Okay.
Okay, take care. Bye-bye.
Bye.
Okay, any other questions out there? Well, if there's no further questions, as I say, if there are questions that come about after the seminar, please give us a call at the number listed there on the page. And we can certainly address, Dee Marie, who is here all the time, can address questions, as can the rest of our educational staff. If you have questions, or again, if you want to come in and see if you might be a candidate, schedule an appointment. And again, we take most insurances, and we can certainly get that part of the process covered on insurance. So again, I want to thank everybody for coming out tonight. I'm not seeing any other hands raised. Anything else come on the texting portion, Dana?
Nope, I think we're all set.
Okay. Well, again, thanks everybody. Appreciate you coming out, and let us know if you have some questions.